people are being turned away from the Charlotte Maxeke Academic Hospital. They tell us that they were not told that their appointments wouldn't go ahead. We've also heard that there were no working fire hydrants there, and that there was a general lack of maintenance. Firefighters took 2 days to extinguish the blaze, and patients were evacuated from the hospital. They're now receiving care in other hospitals. Gauteng Premier David Makhura announced on Saturday that the hospital would be closed for 7 days, but how realistic is this time frame? Masego Rahlaga is out there outside the hospital talking to some of the people there, and Masego, as I mentioned, many of them haven't even been told that their appointments were cancelled.
I think that's the concern by many of the patients who've been turned away here, Jane. Some of them feeling stranded, not knowing exactly what to do because of the fact that they've been turned away, and the fact that although some of them say that they did arrive on Friday for appointments such as chemotherapy and they were turned back because of the fire, they were told to return on Monday, and they didn't hear over the weekend that the hospital would be closed for 7 days. But I just want us to listen to a pregnant woman that I was with earlier on, who explained to us the kind of inconvenience she experienced when she arrived here to find that the hospital is closed.
Because asabe singazi sonke ukuthi isibhedlela sishile.
And inconvenience lena ngoba nisebenzisa imali ukufika la.
Yeah, hayi shame mina ngiphathekanga kahle ngempela into engiyibone namhlanje la kule sibhedlela.
Okay, sisiyaxolisa.
Masego, maybe you could tell us more about what she said, and also if it's true that the hospital will be ready in 7 days.
Well, Jane, really what the pregnant woman was saying was that she had an appointment for a cesarean section at 7 a.m. this morning. She came all the way from Soweto to give birth to her baby. She's heavily pregnant. She had a big bag with her, an overnight bag with her baby's nappies inside, etc. But unfortunately, because of the situation, she's had to turn back. I did advise her to go to Chris Hani Baragwanath Hospital, Jane, and I just want to give the viewers some information on a hotline they could call. I think it's important. If you, for instance, want to know where your family member has been taken to, whether it's Chris Hani or it's one of the hospitals in Pretoria, you need to call 0800 228827 or 0800 428 8364. In terms of whether or not the hospital would be ready in 7 days, Jane, I'll bring in the spokesperson of the City of Johannesburg's EMS, Emergency Services, who will tell us a bit more. Ndata, thank you very much for your time. I just want to find out from you, the question that on everybody's mind is that the fire lasted for so long and obviously has caused a lot of damage. So is a 7-day closure realistic?
Good morning, Masego. Good morning to our viewers. The 7 days closure of the hospital is dependent on what will then needs to happen from now up until that period, because as you know that the fire was stopped on Saturday around 12 o'clock, and then from there we started doing what we call damping down, where we are actually looking at spots where the fire can reignite again, and then cleaning and making sure that the fire does not reignite. And then the second phase that came, then it will be your structural engineers that will come and check the structural integrity of the place where the fire was. Those processes, as it unfolds, then it will talk to the period of 7 days, if whether is it feasible for it to be done completely by 7 days or not. That information lies on that process.
Now tell us a bit more about the kind of damage that was caused, because I remember on Saturday there was also information that there was a structural collapse that was hindering the firefighters from gaining access into the hospital. So obviously there's quite a lot of damage that still needs to be repaired. So just describe to us exactly what we're talking about here.
Yeah, no, correctly. What happened when we were containing the fire and dealing with firefighting? The floor above the storeroom where all the medical supply was caved in and collapsed into the storeroom, which made it difficult for us to be able to do our work. But we continued, when that happened, then we threw firefighters out of the building because we were worried about their safety. we started doing what we call defensive firefighting, meaning that we are taking the fire outside the building up until we were able to contain the fire to a certain level and then to be able to move in and then do an offensive firefighting. So yeah, that's the situation. And what I've heard from some of the guys that have actually gone into the building, they were concerned with some of the pillars within the area where the fire was, to say that they have caved in a little bit. So the structural engineers, then they will give indication as to what's the level of damage when it comes to that.
Just my other question is, of course, about the fact that this was a storeroom that had all the medication supply for the hospital. Could nothing be salvaged from that storeroom? Were all the medicines burnt?
Yeah, it's most unfortunately that's the situation, Lesego. On our investigation, when the fire was contained and stopped, we moved into the building and then there was nothing that was safe. Everything that was inside the storeroom was actually burned.
Thank you very much, Mr. Matobako. Well, Jane, as you can see, as you can hear from the EMS spokesperson here in the city of Johannesburg, I think he answered your question. And I think, us and as well as the viewers can tell that, that 7-day period is probably not feasible. If you look at the fact that there was a structural collapse, as well as him now indicating that the firefighters were concerned about even pillars now also starting to cave in. So I think we can probably expect that 7-day might just be extended. And in the meantime, the Gauteng Health Department will have to just vigorously communicate with people who use this hospital about where they need to go.
And Masego, I should imagine, just stepping back a little bit, it must have been the most traumatizing experience for patients and healthcare workers alike.
Well, Jane, I mean, you can imagine when the fire started on Friday, the firefighters did think that they had put it out. It started earlier on Friday. In the evening, we heard that the fire actually reignited. And you can imagine, the space that has been burnt. It's apparently quite a huge space that has been damaged. And so many people had to move from here. This is a very big hospital, Jane. It's a very important hospital in the country and in the continent, actually. It's almost as important as the Chris Hani Baragwanath Hospital. So the number of patients that had to be moved, first of all, you can imagine the type of chaotic scenes that probably took place with some of the nurses trying to save their patients. There's also the fact that this hospital is very important in the fight against COVID-19. So it's also the fact that those patients had to be moved from their COVID-19 wards or even ICU to the other hospitals. It's also a hospital that is very important in terms of patients who are here for big surgeries. So those patients, about 130 of them, moved to Chris Hani Baragwanath Hospital. Another group moved to Steve Biko Hospital. So I'm sure it was quite a problematic scene, especially looking at the fact that in Gauteng we've already heard how we are short of ambulances. So I'm just imagining how much effort it took from the workers and the people who, the EMS officials, have to drive those ambulances to get all these patients out of the hospital and then to the other hospitals. It's also still going to be a very challenging time, Jane, because it's now the efforts of trying to get a hold of all the family members to inform them where their loved ones have been taken to.
All right, Masego, let's leave it there. Thank you. Global